about being a master healer unless you're talking about healing the ills of your community. Whether you're talking about the Yellow Emperor and the Huangdi Neijing, speaking to that, whether you're talking about Amun-Ra from the African origins of the pyramid builders, all of them speak to the need. If you're going to rule, if you're going to have a healthy population, you have to look at the population, not just one-on-one. This speaks to that. Psychosocial stressors, social isolation, personality factors are impactful in terms of your brain health. We have major depression and sickness behavior. All of that is a circular loop. How do you break it? One of the values with the NADA protocol that where it really distinguishes itself, I found, from the other complementary and integrated modalities, is it's passive. All you need to do is walk in, sit in a chair, and we got you. No matter how distressed you are, you don't have to have that conversation. It's not necessary to go through a full diagnostic evaluation first. There is no diagnosis, whether on the Western side or on a traditional East Asian medicine side of things. I'm asked the question, well, everybody is individual. Shouldn't treatments be individualized? Even within the protocol, that is possible. It's a 1 to 5 point protocol. Everybody doesn't get to 5. I found just as much benefit just using 3 consistently and seldom use 5. But the way in which it became identified as a 1 to 5 point protocol is that once those at Lincoln started to gain the notoriety and national attention from the work they were doing in the South Bronx, states started to develop laws and rules around it. And of course, the bureaucrat doesn't want a nuanced diagnosis. They want, is it 1 point, is it 5? Is it 10, is it 6? So we settled on 5 points, 1 to 5 point protocol. But there is some variation within that. But the greatest variation comes in terms of the provider themselves and how it really makes it easier to establish that relationship without needing to have the what it can often be a barrier of professionalism, where you have to go through your diagnostic check sheet first. You have to make sure the insurances are all on board and in place. This is so cheap. The only cost really is who the provider is. Those of you who are familiar with acupuncture in the audience know that a single treatment, as far as the materials, might not cost any more than $1. More than $1. The cost is, what is your facility going to cost? Are you using folks you have to pay top dollar, like a full body acupuncturist, a comprehensive acupuncturist to provide it, or are you going to use your existing staff to provide it? Your peer counselors, your social workers, psychologists, those who run groups. Using your existing workforce or even volunteers, this is extremely cost effective, can be easily panned out into communities, centers in terms of outreach, but still remain connected across the cycle of illness, from crisis all the way up to a wellness support. And again, can be completely introduced from a standpoint where before folks might be ready to learn Tai Chi, or they might not be ready to learn yoga or the breathing or the mindfulness exercises, but this is something that is readily accessible and can open the door to all the rest of it. So the ear is only one of the many microsystems in the body, and they range from very simple to the highly complex. They exist in multiple locations, including your motor cortex. You have a stroke in one part of your brain that affects one part of the body, another part it can be mapped out as a human, a replica of your physical body. Your thalamus controlling pain is also mapped out according to the body. All of these structures have connections with your ear. All the yin meridians and yang meridians cross through the ear. You have those three structures, your endoderm, ectoderm, and mesoderm that you find in that fetus, all going through the ear, and they affect all of these other microsystems that also exist within the body. There's a connection there. This is my favorite picture of the NADA ear, when you really see the baby and the ear that is superimposed upon a human being. Those are the 5 points that we use within the year, and each of them has very detailed neuroanatomical correlates. I choose to focus on the very simple emotional correlates that we discuss with patients. We have the sympathetic in terms of stress and muscle tension. You get that stress at the end of the day, the neck is tight and all that, you get the treatment, it just tends to just drop within a half an hour. We have Shin Men, known as Spirit Gate, also for mental clarity. A master point that we always include. For many people, just a magnetic bead or a seed on that point is enough, especially within a group setting. I've actually taken to not even doing the needling first. It took me a while to really get to the acupressure side because the needles still seem to give a more robust, immediate response. But group acupressure is also extremely powerful. If I'm doing a group now, I'll do everyone with the beads first. Only as Shin Men. I'm going to leave them with that anyway to go home with, and then say, who needs more? And invariably, there's at least 25% that say, I'm good, and they look like they're in the zone. You know. There's kidney, that's related to fear, liver, the emotions of anger and irritability, lungs, sadness, and depression. Is this not the bread and butter of mental health and mental health disorders and conditions? So detox is not only detox from a substance. Let's not get locked into the opiate, is it cocaine, is it meth? And this protocol distinguishes itself as being valuable across the spectrum. Even for prescribed medications like, say, Effexor, that has a notoriously short half-life and causes withdrawal if you stop it abruptly. The benzodiazepines we might prescribe, the opiates for sure. So, but it's not just that. It's also this sort of emotional detox, like you all experienced on your campus over the past week in response to trauma, war, and those sorts of things that are always very complicated, but raise a lot of feelings. How do you get people to sit at the table again and have a conversation? This is now being promoted as part of a restorative justice practice for both sides of both victims and the victimizers to be able to sit at the same table together and have a conversation. So the NADA protocol is not just a needling technique, it's also a psychosocial process. And in our trainings, we teach our trainers and trainees to always be able to incorporate that point as even being more important than the needling, is this psychosocial side of things. So disease is not an individual isolated psychophysiologic function. Disease is a personal and social opportunity for transformation of attitude and lifestyle. And the opportunities are ancient and ever present and relevant, including our contemporary bio-psycho-social spiritual paradigm of modern mental health. But I'm starting off my lectures with that quote from the American Psychiatric Association 50 years ago. They don't have it. They don't know how to do it. They need us. It's important. It was wonderful that we're getting this seat at the table, because the bio-psycho-social spiritual continuum that is spoken about heuristically in mental health as a goal, where is the operational tool that will allow you to achieve that? I don't know of anything that is better than our protocol and the trainings that we give to support that. Lao Tzu speaks to social determinants of health. He was the keeper of the Chinese Imperial Library during the Warring States period. Talk about wars. There was hundreds of years of war. Believed that people were inherently good-hearted. Believed when organizational structures are oppressive, people act in unnatural ways. When you have that patient who is coming in trouble with the law or in trouble with his or her wife or husband, you know what I'm saying? They may come in and say anything just to get off the hook. You can't you don't want to always go with what is first said. With this, it's nonverbal. They don't need to say a word. What we're focusing on more than anything else is that relationship, a healing relationship that is real, that is authentic, and that will keep folks coming back. Lao Tzu believed that promoting natural health and independent development is best. But how do you do that with someone who's hearing voices telling them to kill themselves and might be ready to jump off a bridge. How do you do that? You can ask them to come in, sit down, have a seat, get treated, and let their internal ability to reflect, to meditate on where they are take place, and be ready to have a conversation from where they are now. And believe me, they will have moved from where they came in the door to where they are after the treatment and be much better able to have a sensible conversation. So, with that, what I'd like to leave you with is to encourage anyone who has influence here in California to please look for a legislator